Hello there, in this video we are going to discuss thiamine deficiency or vitamin B1 deficiency. Stick to the end of the video since we are going to solve two cases about this deficiency so you can have an idea about how a clinical presentation of vitamin B1 deficiency is going to happen. Let's get straight into it. Thiamine is known as vitamin B1. It's a water-soluble vitamin. It's essential for carbohydrate metabolism and neural function. That's why when we are deficient in vitamin B1, the usual symptoms are gonna be either neuronal, so you're gonna get fatigue or neuropathy, and the other symptoms are gonna be cardiovascular, so you can get tachycardia and also you can get edema, especially in the legs. The dietary sources of vitamin B1 are whole grains, pork, legumes, and seeds. But here's the thing, refined rice is a major culprit in areas with endemic beriberi. A person that is B1 deficient is gonna have beriberi. So now let's understand what is the function of vitamin B1. Vitamin B1 is an important coenzyme in many different pathways inside the body. For example, Krebs cycle, glycolysis, also is involved in amino acid metabolism. As you can see in the picture, when we ingest thiamine, we ingest it in the form of thiamine or thiamine phosphate. But inside the body, when it's uptaken by the small intestine, in the liver, it gets converted to thiamine pyrophosphate. From there, it performs its function. It's important for pyruvate dehydrogenase, alpha-ketoglutarate dehydrogenase, branched chain keto acid dehydrogenase, transketolase. This explains the reason why we get these symptoms from the deficiency of vitamin B1. Since it's going to interrupt these pathways, thus we are going to have less ATP available for the cells, and this is going to affect the organs that need high energy, such as the brain and the cardiovascular system. Clinical presentation of vitamin B1 deficiency is beriberi. There are two types of beriberi, dry beriberi and wet beriberi. The dry beriberi is involved with the nervous system. So the symptoms include peripheral neuropathy, such as burning feet, numbness, muscle weakness. Also, you're going to have wasting, foot drop, and hyporeflexia. These symptoms are due to lower ATP availability for the nerves. So this person might have foot drop, which is when you walk, your front foot is going to drag with you. They're not going to be able to lift it unless, of course, consciously. They're going to have wasting, so they get weaker over time. Also, they're going to have hyporeflexia. Wet beriberi is involved with the cardiovascular symptoms of thiamine deficiency, such as dilated cardiomyopathy, edema, especially in the legs, and high output heart failure. This leads us to Wernicke-Korsakoff syndrome. This is a German name, I don't know how to pronounce it, to be honest. This is seen especially in alcoholics or malnutrition patients. With thiamine deficiency, usually the case presentation would be in a patient that is malnutritioned, and alcohol also impairs the absorption of many nutrients. So you'd suspect that they're deficient in vitamin B1, and when they are malnutritioned and also an alcoholic, this is a perfect combination for disaster. So there are two phases of this syndrome. Wernicke's encephalopathy, which is the acute phase. The symptoms of it are ophthalmoplegia, ataxia, and confusion. So when Wernicke's encephalopathy progresses without treatment, it becomes irreversible, and it takes form in Korsakoff's syndrome. Here you get memory impairment, confabulation, and it's irreversible, as we said. For the diagnostic strategy of thiamine deficiency, most of the diagnostics for this case is going to be empirical. You're going to depend on the symptoms and administer thiamine. And if the symptoms improve, then the cause was obviously thiamine deficiency. But sometimes you can do some testing before that. The clinical tests that we can do are erythrocyte transketolase activity test. As we said previously, vitamin B1 is involved in many different pathways. One of them is transketolase. Also, serum thiamine levels can be done, but from my experience, I've never seen this test done in many different labs. They don't provide it. Lactate pyruvate ratio may be elevated too. So when do you suspect B1 deficiency? As we said, alcoholics with confusion, malnutrition too, chronic heart failure patient on furosemide. We're going to get to that in the next slide. Diabetics with neuropathy. Diabetes depletes vitamin B1. They suspect that through two different mechanisms. In diabetes, when sugar is excreted from the kidneys, due to the high osmolarity, it takes some vitamin B1 with it. So this causes a decrease in vitamin B1 in the body. But also there's a different mechanism that might be the reason for neuropathy in diabetic patients. And this is because of the high sugar in diabetic patients. This might cause and increase usage of vitamin B1 and thus cause the depletion of vitamin B1 inside the body. In Crohn's and celiac patients, you should suspect malabsorption, and this is true for a variety of different vitamins. So vitamin B1 is one of these vitamins that is malabsorbed in these conditions. Also, patients who have bariatric surgery might have lower absorption of vitamin B1. Now, there are many different drugs and conditions that causes the depletion of vitamin B1 or the malabsorption of vitamin B1. One of them is diabetes, as we explained. Also, alcohol causes lower absorption of certain vitamins. Chronic diarrhea and gastrointestinal disease, such as in a case of Crohn's disease. Chemotherapy in case of 5-fluorouracil or cisplatin. These also intervene with certain pathways for energy production, so therefore they deplete vitamin B1 or prevent its usage. Loop diuretics such as furosemide that increase the excretion of vitamin B1. Dialysis patients, remember, since this vitamin is water soluble, is gonna be lost during dialysis. Since the production of ATP from glucose requires vitamin B1, when you have high glucose, the more vitamin B1 is gonna be depleted. That's why when you have high carb intake and low micronutrient diets, vitamin B1 is going to be easily depleted. High metabolic demands such as in sepsis, trauma, or malignancy, we know that tumor cells have higher demand for ATP. That's why they deplete vitamin B1 faster. And high caffeine intake. Now let's start with case 1. The patient is a 52-year-old man. You have the background information on him. He is a chronic alcoholic, homeless, and he has a poor diet. The chief complaint of the patient is that he has a progressive shortness of breath, swelling in the leg, and fatigue. He has alcohol use disorder, drinks daily, no stable meals, mainly processed snacks or alcohol. He lost 8 kilograms over 2 months. Upon examination, the patient had tachycardia, elevated GVP, bilateral leg edema, a large heart on chest x-ray, no pulmonary congestion, mild bilateral foot numbness. Now let's digest this case. The patient has progressive shortness of breath, swelling in leg, and fatigue. As we said, when a patient has a swelling in leg, this is, of course, is due to many different conditions and drug use. So this is, of course, not a great indication, but this actually gives us a piece of the puzzle. Swelling in the leg, fatigue, shortness of breath. All of these are still signs of thiamine deficiency. In this case, of course, you just got this case. You don't know it's thiamine deficiency or not. You look at the history. Alcohol use and malnutrition, 2 great indications that the patient might have vitamin B1 deficiency. Also wasting. He lost 8 kilograms over 2 months. The examination showed tachycardia, elevated GVP, jugular vein pressure, bilateral leg edema, and a large heart on chest x-ray, which means high output heart failure. No pulmonary congestion, so you can rule out any other problems that might be concerned with the respiratory system, and also mild bilateral foot numbness. This is the peripheral neuropathy. So my diagnosis for this is a case of wet beriberi. What I'm gonna do now is administer 100 milligram of IV thiamine, and also I'm gonna see if the case resolves. If it does, I'm gonna follow up with all supplementation, and then I'm gonna monitor him over days. Let's go to case 2. And the second case, we have a 36-year-old woman. Some background information on her include she has been a vegan for 2 years with no supplementations. This should give you a clue that she has vitamin deficiencies and many other nutrient deficiencies. Chief complaint includes brain fog, frequent headaches, unsteadiness when walking. History: she avoids all animal products. Recently lost appetite, no alcohol use. She's not diabetic. She has no fever, infections, or other major issues. Upon examination, she has normal vitals, mild ataxia on heel to shin test, slight difficulty with eye tracking. Upon clinical testing, the results were mild anemia, normal B12, and folate. MRI shows bilateral symmetrical lesions in mammillary bodies. Now let's digest this case. The patient has been vegan for 2 years with no supplementation. The vegan diet is not arranged properly with the correct food intakes. You can easily get a deficiency in certain vitamins. Her chief complaint is brain fog, frequent headaches, and unsteadiness when walking. So ataxia, and you got some neurologic symptoms such as confusion. And look at her history. In her history, there is no indication that she has a deficiency. She doesn't drink alcohol, she's not diabetic, she has no fever, infections. So you can see that in her body there is nothing that is depleting these vitamins. It's probably a cause from malnutrition. And through examination we can see that the patient has ataxia on heel to shin test, and this test you move your heel across the other shin, and if there is any involuntary movement you see, or when you see unsteadiness on this test, you can determine that the patient has mild ataxia. The patient also has ophthalmoplegia, which is slight difficulty with eye tracking. Also, thiamine deficiency causes lesions in the mammillary bodies, which is a great indication for thiamine deficiency in this case. My diagnosis for this case is dry beriberi. We do the same thing for case 1. We either give oral supplementation. We can also give IV thiamine 100 mg. If the symptoms resolve after our administration of the drug, then our diagnosis was right. Lastly, this is a table that provides all the forms of vitamin B1 that you can find in the market. First form is the water-soluble form. All other forms we modified them and now they became lipid soluble. The benefit of making thiamine lipid soluble is of course to prolong its half-life, and also so that it can cross the blood-brain barrier, so it can treat neuropathies and neurological symptoms. L-thiamine is obtained from garlic extract, so it doesn't give the GIT upset that other forms of thiamine might give. That's it for today. Thank you for watching. Consider subscribing to the channel. If you have any additional notes or correcting any mistakes I made in this video, you can write these notes in the comments. Thank you for watching. See you in the next video.